Hi, I released this video approximately 18 months ago. I'm editing it today and I'm re-releasing it. It's so valuable, it has to be seen. Anyone that's on testosterone or steroids needs to understand the potential side effects on the cardiovascular system. So please watch this video in full length. Please take notes. Please be aware, and please make sure that you discuss the use of testosterone and or steroids with a very good physician. Thank you so much. I hope you enjoy the video.
Hi, welcome to my video today on heart protection for men that are on testosterone and or anabolic steroids. Since 2015, when the federal government, the FDA, placed an increased warning on all testosterone products that they may cause heart attack, stroke, and death, this has been really a huge focus for any physician, any doctor or caregiver prescribing testosterone for men. Here it is right here. Don't be alarmed. I wrote this last night. It took me a few hours and I poured everything here that I've been involved with for the last 12 years as a physician expert taking care of men on testosterone and, of course, taking care of men on anabolic steroids, making sure that they stay healthy and doing the best I can to get them off and stop not to use anabolic steroids. So it's a multifactorial process here. Like a lot of things in internal medicine, there's never one variable, there's many. And before these studies came out in 2013 and 2014, two landmark studies, you could check, we postulated that anabolic steroids and testosterone could indeed cause heart disease, but yet we didn't ever really have any conclusive data. And even today, from these studies, there's controversy from experts. Not sure if it's actually true that testosterone, TRT itself, causes heart disease that we'll go into in a minute, and what are the mechanisms. So it's controversial, but I can tell you this, in my practice, when men that are under my care, I developed protective protocols, and I'm going to share it with you today. So let's get into it. Put the thinking caps on because it's going to get ugly. So heart protection associated with testosterone and anabolic steroids, it's a multifactorial process. We start over here. First, let me give you a schematic. Testosterone itself and anabolic androgenic steroids, there's risk. These agents mediate through receptors on cardiac tissue itself. They're called myocytes and endothelial cells. This is the normal healthy heart. And then what happens through these pathophysiological processes that I'll discuss, superimposed with many other variables, which we'll go into, lead to a process in the end: myocardial infarction, heart attack, blocked artery, heart disease, heart failure, poor quality of life, and unfortunately early death. Now, this is the number one cause of death in the United States. So you put it on steroids, possibly. So let's get back into it. And then in the end, this is the secret, and this is what it is. This is what I do. I assess every man individually from my 2 decades actually of experience, starting from medical school. In the last 12 years of taking care of men on testosterone and understanding men on steroids, what they've done to themselves, and being an expert in this for men on androgens and steroids included, understanding how do we protect protection from these agents on the heart. This will be the end. This is what it's going to be in the end. This is the real secret sauce. That's the secret there. Let's start off here. The receptors, the heart itself has receptors, androgen receptors, everyone knows, that's skeletal muscle receptor. It's a muscle. It has special receptors. They're not sure. Part of it looks like it's skeletal muscle-like, but then there's cardiac tissue. There's myocytes, myocardial tissue, and then there's endothelial cells. So this is the heart. That's the heart. We're going to talk about the heart. That's the heart. And this is your inner wrapping of a blood vessel that lays on left coronary artery, right coronary artery. That's my general schematic. And this is normal. This is a normal opened vessel. Over years and through disease processes, we get this clot, lipid atheroma, or plaque. And then when it closes up enough, you get a blocked vessel. Depending on where it is, this is the blockage, it's plaque, leads to a heart attack. So, through these receptors being stimulated on the heart, and then the actual endothelial cells, which is the inner wrapping of a healthy artery, the coronary arteries, there's processes that are pathophysiologic processes. Hypertension, testosterone, anabolic steroids can lead to hypertension. It's well known for decades. Lipid abnormalities, the LDL, bad cholesterol goes up, the good cholesterol, this protective goes down. I see it all the time. Yes, dose dependent, we'll get into it. Polycythemia, through this process, steroids, testosterone, even testosterone TRT on susceptible men, you get polycythemia, increase in red blood cells. That in theory, this is complicated stuff. Everything I do is evidence-based, and there's not much evidence for that one, I can tell you, that you get an increased potential in the concentration of the blood, potentially leading to a hypercoagulable state. Hypercoagulable state just means that you're going to get a clot. You're building a clot. So there's hypercoagulable state. That itself is a multifactorial state from all of these. We think in these studies, it looks like if you actually do have an increased outcome, unfortunately, from TRT itself, forget steroids, to myocardial infarction, heart attack, and stroke and death, it ends up being a hypercoagulable state overall. It's the end accumulation and progression of plaque. So let's keep moving. Sleep apnea, steroids, testosterone causes obstructive sleep apnea. We see it all the time. Why? It has direct effects on the central nervous system, not to mention men can get bigger, a big neck, and that leads to central obstructive sleep apnea. No question about it. And then direct effects. So the androgen receptor from testosterone and steroids, which there are many, directly affects the endothelial tissue at this point and the heart, the myocytes here, myocytes and endothelial tissue, directly by some other mechanism. Put it on steroids. And it can grow it, we'll talk about this in a minute, and it can progress the plaque. No question about it, those are right there. Hypertension, abnormalities in lipids, polycythemia, hypercoagulable state, sleep apnea, direct effects. That's it. There's nothing else in the world no one will come up with. That's the list right there. Now, and there's diabetes. I put that to the side because if a man has diabetes, that just worsens his risk for generating all these problems, especially plaque and heart disease as far as coronary artery disease. Now, what variables are plus and minus? Plus and minus. Men, different genes, family history of heart disease, age. You don't see 25-year-old kids getting this stuff. I've seen some late 20-year-olds having bypass surgery. That's horrible genetics and just using steroids. Hey, that's how it goes. Now, but you got guys in their 40s and 50s, 60s. It happens all the time. But is it just because they're men and they have bad family histories and they have all these problems, pathological blood pressure, cholesterol, diabetes, and they're going to get it anyway? Or is it really putting it on steroids? We don't know. I look at the whole thing and I'm very conservative with everything, and that's right there. Nutritional, diet. No question there's experts in the world, and some guys on my Facebook, won't mention names, great guys that are nutritional experts, and they talk about deficiencies in magnesium, vitamin D, and zinc. These are great things. These are contributors, multifactorial contributors. There's 20 things, if not 500 things going on that lead to these things. But in the end, do you put them on steroids and testosterone? Let's keep going. Behavior. If you smoke, it's going to make this worse. If you drink, if you do drugs, if you're not active or you're too active, if you have stress, anxiety, depression. I mean, are you kidding? We know that depression certainly can lead to worse heart disease, and if you have heart disease, unfortunately you become depressed, and that's chicken or the egg. So, and then other drugs, ethanol, plus minus. Ethanol protects in small quantities. Moderate drinkers live longer and have less heart disease. No one can argue it. It's science. Just don't drink too much. It's 2 drinks a day for a man. And we don't need to get into some of the details. That's what it is. Narcotics. And then this is amphetamines. Amphetamines, unfortunately, George Michael passed on. I'm not going to get into why. It's sad. I love George Michael. He was a great guy. Incredible artist. And what a musician. I'm from the 80s. He had drug problems. He had heart failure. Amphetamines, I guess, narcotics. Amphetamines, they blow the heart up. So let's keep going. So adding it all, then the very interesting piece is, this is bro science. So with these drugs, there are other drugs called they're called bro science. They're added drugs, ancillary drugs that men use classically on steroids for recovery and for while they're on steroids. These are bro science drugs. They're aromatase inhibitors, HCG, SERMs, human growth hormone, IGF alpha. Very complicated. So you put this in the mix. Other, which would be medical conditions. If you have any other medical condition that leads to systemic inflammation, like rheumatoid arthritis, that 100% is going to increase potential for certainly this piece, which is plaque progression and coronary disease. There it is. So in the end of the day, the heart goes from a healthy heart to left ventricular hypertrophy, LVH. This is heart failure. And then it goes to coronary artery disease, that's plaque. And as I said, heart attacks, heart failure, this is the diseased heart from an enlarged heart. It's no question the anabolic steroids, multiple studies, multiple very well done studies show that when you use anabolic steroids, this gets big, this can get big too. That's not good. That's not good. You don't want to enlarge this guy, because it shrinks the cavity, your ejection fraction goes down. This is heart failure. Not good. It's not worth it. But is it straight from testosterone, doc? Very complicated. Very complicated. If you get a process that moves this way, and with hypertension, lipids, LDL problems, HDL too low, polycythemia, hyperalcohol state, sleep apnea, direct effects, you have this running down this way, you're going to be in trouble. I protect against it. Here's the bottom line. Testosterone, steroids, there are risks. You better understand the risks. There's no more, in my opinion, just going to a general practitioner or some doctor that's just doing it as a side job. You better understand all this, doctor. Everything better be understood. It's a full-time day job. So, when testosterone and anabolic steroids are used, dose. Dose. These are the pieces that we have to do and talk about. You should only be on testosterone, of course, if you need it for your mood and your libido, and you've been well cared for and diagnosed properly. Anabolic steroids, I'm not going to go into it. People use them. They better be careful. What do? Types of steroids, types of testosterone. You know, in the studies, there's question that some of the actually doses were too low. That was some of the problems, thinking that cardiac disease, when you have low T, these are the general men that had low T, and in the VA, it was a JAMA, a very incredible JAMA article you should look at. In the end, they discussed what were the real details of the studies. There's a lot of question marks on it. There's experts today that are rebuking this and saying that the feds went out and put these warnings on with not proper evaluation of the data. I'll leave that alone, because I think in the end, it's potentially true. I've seen it. I've been involved in it. I'm an expert on it. You got to be careful. So, steroid types, I don't know. Is it injectable testosterone versus transdermal? Is it tren, equipoise? Is it with steroid? Very complicated. Obviously, what you should consider is using these agents, testosterone, for men, for TRT, which is my specialty, for men that need it, the lowest possible dose, so he feels well and doesn't cause these problems, therefore, hopefully, limiting and allowing, so this doesn't happen in the end through these processes here. So, and cycles, when men cycle, they end up using steroids, they end up having anabolic steroid-induced hypogonadism. Then they have gonadism, hypogonadism, and they need to be on testosterone. So, very, very classic, and that's a big piece there. Next piece is for protection. This is the protection. This is what I do. Lowest possible dose. Keep it sustained. Actually, in addition to this, watch other variables like estrogen levels. Very careful, though, that I'm careful with using some of these other drugs here, because you got to be careful. These aromatase inhibitors are classic for lowering HDL, and in one case, I feel that the man was on these drugs and he had a very bad, this whole left main shut down 90%. He was in his 30s because his genetics and because he was on steroids and he used aromatase inhibitor, and his HDLs were in the teens. and he ended up having a block there. They opened it up, fortunately, and he's doing okay today. He's just on a very stable dose of testosterone, doing well. None of these other drugs. Diet, Mediterranean diet. Yeah, so if you're on if you're on testosterone, keep the dose stable, keep it low, so you feel good. Diet, Mediterranean diet. It affects all the hypertension, lipids. Supplements, extra virgin olive oil. What else? CoQ10, omegas, right? All these green tea I have here, because there's great supplements, and that works with my experts that I agree with nutritional deficiencies, vitamin D, zinc. Absolutely, get it mainly through your diet, but supplements work, and that's a whole other topic. Exercise. So if you're on testosterone, exercise protects any man like this. Basic exercise, high intensity interval training. So don't exercise too much or too little, just get it right. And the best training, in my opinion, is the high intensity interval training. Protect the heart. Now, here's the real medical secrets. Statins. If you're on testosterone and you have any abnormalities in this evaluation by a medical expert, you should be on a statin. I'm just going to say it boldly. Most men should be on statins anyway. You should go see a doctor and get your labs, get a history and physical, consider getting a coronary artery calcium score. Come to me. I'll help you out with it. ACE inhibitors. Put the thinking cap on. ACE inhibitors and ARBs. These are blood pressure meds. Now, these can protect the pathway. They protect the pathway. ACE inhibitors, ARBs, used with caution with experts like myself and physicians that know what they're doing. Cardioselective beta blockers. Bistolic. It's an increase in nitric oxide in these vessel walls. Very, very incredible. PCSK9 drugs, Zadia. If statins cause some muscle breakdown and some statin-induced myalgias, we have new drugs now. Very complicated stuff. You're going to see these in the future. PCSK9 molecular drugs. They're incredible new drugs. Very expensive, and hopefully they're not statins though, but they work incredibly. And we'll see over the years how they turn out. Aspirin. Aspirin, obviously, is if you have plaque, it stabilizes the plaque. It's an antiplatelet agent. Very complicated stuff. Just don't take aspirin. Diuretics, calcium channel blocker drugs. These are all drugs that, again, that work up in the lipid department, in the hypertension and lipid department. Metformin is a secret drug. If you have diabetes or pre-diabetes, metformin not only is an excellent drug for the initial agent, is an oral agent to stabilize and to retard against pre-diabetes going to diabetes, and the initial oral agent for diabetics that make a diagnostic for diabetes. But this metformin, this drug, has endothelial protecting properties. Very, very well known. Check it out. And then the last couple here, PD5, this is Cialis and Viagra. These are real nitric oxide drugs. There's no question that these drugs are not only incredible for quality of life, but they bathe and they're thought to protect the endothelial tissue. We've seen it in the carotid artery studies. And I have many men that are on combinations of these drugs that are very happy and very stable, and their hearts are very, very healthy. You better be careful. You better have a physician that knows what he's doing. This is complicated. CPAP, because you got the sleep apnea, so you better deal with sleep apnea. And phlebotomy I have there. You just don't give testosterone and just phlebotomize everyone. But once you have the lowest possible dose on, and you've ruled out secondary causes of polycythemia, hereditary hemochromatosis, and other secondary causes of lymphocytic causes, polycythemia, you can safely phlebotomize men to keep their hematocrits and stable. We do it all the time. But you have to make sure you're not just phlebotomizing in face of just giving testosterone without managing it. So you have to be careful with it. You can't just indiscriminately phlebotomize men because you just don't know what you're doing. So in the end of the day, these are the protective pieces, hopefully maintaining a healthy heart. If a man is on testosterone, the steroids you have to be just very concerned for, and you have to be careful with the steroid users. But steroid users have to understand that they're at risk for this. And based on these factors, what's the acceleration, what's the coefficient to getting down to heart attacks and heart failure? And these are the protective aspects right here that are beyond the behavior, the diet, and the exercise. These are medical. So there it is, complicated process. Please consider checking the website out, www.thomaso'connormd.com, and consider a consultation. I'd love to help you. Stay healthy, strong and healthy. Thomas O'Connor here. I'm glad you made it to the end of the video. If you liked it, hit the like button and please subscribe to our channel. And I look forward to bringing you more cool and interesting videos just like this in the future. Stay strong and healthy.